and how that might affect care delivery here in Michigan, as well as what medical professionals need to know about their licensing boards and kind of some of the guidance that's given at the national level and how that might affect them, especially as folks might be concerned about when they're talking with patients, how that might affect you know, their licensing status and potential disciplinary action at the state level. And then, you know, again, how does that impact care delivery now that patients might be more forthcoming in disclosing their use of marijuana, since they're not concerned about repercussions of using it illegally? What needs to be taken into consideration, and also the fact that that more folks are using it, so needing to ask about that when folks are visiting. So as had these slides, actually had the opportunity to speak in Washington County last year, and these are updated slides, and even from a year ago, we are still continuing to see an increase nationally in those who are supporting the use of marijuana and the legalization of that. So about 2/3 of Americans currently do support it. About a decade ago, only about 50%, a little over 15% opposed it and thought it should not be legalized. When you ask people if they want support recreational use, adult use, and whether or not they support medical use of it, the medical use has a higher percentage. And really, if you add those two together, it's quite a bit, over 90%, I think, if you added them together. I think about 48, 52% on their own. So anyways, I thought that's kind of interesting. And as you can see on this slide, you can take a look at different generations and kind of see the level of support for that. Also, really across the country, you're seeing the regulation of marijuana in some way, whether that's like Michigan, where you have both adult use and medical use, whether it's limited medical use only. So states are starting to adopt their own laws around this, despite the fact that the federal government has not changed anything at that level at this point in time. One thing we do know, though, even as this is changing, this is not necessarily changing because there's new evidence out there showing that this is a safe product. I think there's a perception by the public that it is safe because it's a plant, but we don't really have the evidence there. And as we'll talk in a few minutes, you know, part of that is because it's still a Schedule I controlled substance. And so there's very limited large scale, small scale, randomized controlled studies out there. So a lot of the studies that you see have self-reported information, maybe looking at anecdotal stories versus kind of the IRB approved studies that we need to see, really, to see whether or not there are benefits or risks to that. So and more of the anecdotal information is leaning on the risk side really at this time on benefits. But the other thing is, I think, because of the fact that one of the issues and challenges that we have moving forward as we start looking at laws and how does that impact care delivery is the fact that there's really no universal guidelines on how to use it safely or for therapeutic purposes. So for example, there are many different formulations of cannabis. So what is most appropriate for what conditions? How much? What's the dosing should that be? What if somebody is marijuana naive? How does that affect them? It may be different from somebody else who hasn't used it before. So we're still struggling with that. And then again, some of the funding is not there to do the studies because the federal laws. One of the reports that you may want to take a look at is from the National Academies of Sciences, Engineering, and Medicine. It was a 2017 report, and they did take a look at a large number of studies and kind of went through those. They assigned different levels of whether there was conclusive information, substantial information, moderate information, not enough information, and really looked at the therapeutic benefit of it. And then they looked at it at different diseases. So this is kind of one of the larger compilation of studies out there. Might give you some idea as far as what the literature says at this point in time. As I mentioned, at the federal level, marijuana is classified as a Schedule I controlled substances, which means that there's no currently accepted medical use and treatment for that drug, and also that it has a high potential for abuse, dependency, or addiction. And because it's a Schedule I, it cannot be prescribed legally. It is a violation of the law, federal law, to knowingly or intentionally distribute, dispense, or possess marijuana. And this is also for persons who might be considered to be aiding and abetting somebody in the use of that. So that's always out there and something that health professionals need to remember as far as you are talking to folks about using it, that still is an issue.
Hey, Stacey.
Yes.
Sorry to interject. Is it possible to advance the slides on your end? I think we're still seeing the originating slide. Apologies.
Sorry, I am advancing them on my screen anyways. We might have a technical glitch here. Did you see that slide advance?
Nope, not yet. We'll troubleshoot on the back end here.
Okay, sounds good. Thanks. Sorry about that for all who are looking in. Wanted to let you know that there have been calls to reclassify marijuana. The DA has been asked in the past to change that classification to Schedule II, but up to this date, they have rejected those requests to reclassify it. One thing that we have seen, though, even though there has been reluctance to change the law or to reclassify marijuana in the schedules, is that the U.S. Department of Justice over the last 10 years, about the last 10 years or so, have put out various memos in regards to their enforcement of that and what they intend to do to enforce that. So the first was a memo, was called the Ogden Memo, and that was in 2009. And it really made it clear that there wasn't an interest in really prosecuting folks who were clearly and unambiguously following their state law. So you started to see a little bit of relaxation and from federal prosecutors, guidance given to them is that they would still be able to prosecute marijuana crimes under the federal law, but if somebody really is following their state law, that you do not have to prosecute patients or distributors. And then in 2011 and 2013, we have what were called the Cole memos. And these kind of made it even clearer that really what the administration and the Obama administration at that time was saying is that we feel you should be focusing in on some very core issues, those being things like preventing distribution to minors, preventing trafficking illegally, preventing folks from transporting from a state where it's legal to a state where it's not legal, kind of having sales go to like gangs and cartels, etc. So those were, kind of things that they were saying, let's focus in on these types of issues, and where folks are complying with the states, and we expect the states to have clearly defined rules as far as marijuana use and distribution. We will let the states basically, you can let the states kind of monitor that activity. So many people started operating under that directive and choosing what to prosecute, what not to prosecute. Then when the administration changed after the election, the Attorney General Sessions at that time issued a new memo, basically rescinding the Cole memo and really stating that it was the expectation that the prosecutors would prioritize their enforcement of federal marijuana laws. And Attorney General Sessions said he wanted folks to have the tools to disrupt criminal organizations, tackle growing drug crisis, and thwart violent crimes across our country. So really a different tact from what folks were used to really over the last, probably 6 years before that or so. And then we had the change in attorney generals under the Trump administration. And when Attorney General Barr took over, he really didn't go all the way back to the Cole memo, but he basically indicated that it was not his goal to prosecute and pursue individuals who were complying with their state law, and that really he was interested in seeing more research in that area and was looking to expand the use, that in there. So what you then had in 2016, the DEA was given the opportunity to increase the number of DEA registered cannabis manufacturers. The University of Mississippi was the one who right now is allowed to grow marijuana for research. But even with that permission given, they still did not pass the rules to allow that to happen, and they were not granting any additional requests, even though they've received quite a few over the years. Having said that, they did put out a notice of rulemaking in March and took comments through the end of May this year. So from March 20th through May 2020, sorry. They did take comments. So we'll be waiting to see what comes out of those. My understanding in looking at it, that there was opposition from the industry. And some of the main concerns they had with the way the rules being proposed is they felt that the agency enforcing and regulating shouldn't also be overseeing the research on that. So that was some of the main concern there. Also, the other thing of interest that happened was the passage of the Farm Bill. And I put that in there just because this really took hemp out of the definition of a Controlled Substance Act. And basically, it excluded THC. The way it's written is if it falls under hemp if it has a very, very, very low level of THC, basically. So, and then it does not have to be scheduled under the Controlled Substance Act. Next slide, please. Great. So one of the things you'll also hear is, concerns that with any drugs being used, especially for medical purposes, that if they should be approved by the Federal Drug Administration. We do have 4 approved cannabinoids by the FDA. The Epidiolex oral solution, I'm probably messing up that, was recently approved. And this is really from the marijuana plant to help treat seizures and some very rare forms of epilepsy, Lennox-Gastaut syndrome, and Dravet syndrome. The other cannabinoids that you might be aware of are the synthetic ones that you see, Marinol, Cindrus, Sesamet. And usually these are used to help treat vomiting as a result of chemo treatments. Dronabinol is also used to help treat loss of appetite and weight loss in persons with AIDS. So you are starting to see the FDA take a look at these and starting to move forward in approving some of those. Also, I put this in here before, no action has been taken yet on this, but there is legislation before Congress. It's called the Medical Cannabis Research Act of 2019. And the intent of that really is to expand research. And it requires the Attorney General to appoint additional facilities to be able to produce marijuana for research. Requires 3 in the first year, 4 in the second. As you heard, the rule is going forward, so there may not be a need for this if they can get the rule passed and if they start doing it, but it is out there. Also in the House recently put in its Invest in America Act that was recently passed as part of the funding to help with COVID-19. They put language in there to get things jump started. So calling for some additional evaluations, some reports, and some education regarding driving while under the influence of marijuana. But their goal, one of the goals of the language that was in there was to, again, to expand research in this area. Next slide, please. So let's kind of take a look at what's going on in Michigan. So kind of remembering that we have that federal, it's still illegal at the federal level, but at this point in time, the U.S. Department of Justice has been given direction by the Attorney General, their prosecutors, not to really pursue enforcement if states are doing a good job of regulating and enforcing and monitoring, and individuals are complying with the state law. Next slide. So the 3 kind of major marijuana-related laws that I want to mention today, there is also a kind of a monitoring tracking law as well. But first was the Michigan Medical Marijuana Act, which was passed in 2008. And this is the one that really sets up the system to provide a registry card for individuals who have a debilitating medical condition. It provides the parameters as to how much they can possess. They can have caregivers who can provide, can have a certain number of patients, and then they can provide the marijuana to them, and they are then limited as far as the amount that they can grow per patient as well. They need to get a certification from a physician in Michigan. Then we have the Medical Marijuana Facilities Licensing Act, really, which is the statute that allows for this to be legally sold. And then it has various licensing that individuals who are interested in participating in the industry can pursue, such as a grower, processor, provisioning centers, which is where you would go to get your marijuana, transporters, and then safety compliance facilities. They are not allowed to sell to anybody from the general public. They can only sell to persons with a medical marijuana registry card. And I put the website there where you can find out which facilities those are. And then we had the ballot initiative that was passed in 2018, which is the Michigan Regulation and Taxation of Marijuana Act. And this is the act that does allow adults over 21 to be in possession of that. It allows for the sale to them. And it does set up those parameters as to how much someone can have in their home as far as growing it, how much they can have on their person, where it has to be when they're not using it, what they can do or not do with that. And then it also provides the regulatory framework for, again, licensing, monitoring those individuals who want to be part of the industry and to either grow it, sell it, process it, As you see on kind of the list there, there's talk, folks that want to maybe set up little micro businesses, some tasting centers, that type of thing. So it is becoming a very large industry at this point in time in Michigan. Next, please. The agency that's responsible is within the Michigan Department of Licensing and Regulatory Affairs, LARA. It's the Bureau of Marijuana Regulation, and they oversee all of the marijuana related regulation in Michigan. So all of those laws that we just talked about are under their purview. They do have a very good website. I think there's a lot of really good information there, which I put on here, www.michigan.gov/marijuana, spelled with a J. And that really takes a lot of information from all the different sites. So you can go on there, you can see what the laws are. They have frequently asked questions. If you're somebody who's interested in getting in the industry, they have information. If you're a health professional, they have some information for you there. They do put out notices. So I've seen over time, I'm on the agency's listserv, so I'll get their notices. Sometimes, if products are recalled, they'll put those out there. That information's out there. They have some of the legislatively mandated reports out there. So if you're interested in kind of finding out, how many folks have a card and where and all that information is out on that website. So it's a very helpful website. Next slide, please. Part of the laws gives LARA the ability to promulgate rules, and they have done that. They've modified rules over time, so that's something to keep an eye out on that. And legislation was recently passed, House Bills 4126 and 4127, now PAs 31 and 32 of 2020, that require new labeling requirements to kind of warn into women who are pregnant, breastfeeding, or who are interested in becoming pregnant of the dangers of using marijuana. Next, please. Just threw this in here just so folks know this is Michigan's universal symbol for marijuana products and need to be on the labeling. So we kind of, we talked about the status at the federal level. So how do states get around this? How do health professionals and others participate when it's still illegal at the federal level? So many of the states, Michigan included, really, again, that you can't prescribe it. So instead of prescribing it, there's a process for certifying someone has a condition or recommending the use of it for somebody, so that it's not really, that they're not taking a prescription from the physician and then going to a pharmacy and getting it filled. They're using that certification in Michigan to get their card, which then allows them to go to provisioning centers. The registry, a registry card, sorry about that spelling. A registry card is required. I think we mentioned that before, for you to get marijuana or infused products from the licensed provisioning centers. Next. So if I'm an individual who wanted to get a card, I would need to be a resident of Michigan. I would need to have proof of identity. There's a couple of different ways you can prove your identity. I would need to register with the Michigan Medical Marijuana Program, which includes submitting an application. And in that application, I need to have an attestation certification filled out in writing by my physician. I need to have a bona fide relationship with that physician. That was a change in the law that was added after the original ballot initiative was passed, and part of that was because you were seeing folks set up shops, mobile units, going around just signing people up for cards without really doing a proper medical evaluation. So the legislature decided they wanted to see that put into statute and make that a requirement that the bona fide relationship exists. And then you have to pay a required fee, and then you need to renew your license to keep it active. So As we mentioned before, only currently licensed Michigan physicians can complete and sign that form. Again, the physician and patient must have a bona fide relationship. And I just kind of stress this for any physicians listening out there, or physician or medical practice team members who might be listening out there, because that really is important. And there are steps that need to be taken. So for example, there needs to be a complete and full evaluation. Information needs to be put in the medical record and documented in the medical record. There should be an expectation of follow-up care to see if it's been effective. So not just a one and done, here you go. But again, if it's for a debilitating medical condition, how is it working? Do we need to change things up? Do we need to look at alternatives? So there's that expectation as part of the bona fide relationship that folks would have that in there. So, and then also the other thing I forgot to mention there is that if I have provided you with, I'm a physician and provided you with the certification, but I'm not your primary care physician, that if you give me permission, I will be communicating back with the primary care physician. So again, we're looking at the total care of the patient in that regard. And again, I just thought this was kind of interesting. As I mentioned before, on the website, you can find a lot of information. There's reports out there. But as of the end of June this year, or July this year, there were nearly 250,000 qualifying patients who had a card at this time in Michigan. The top 5 debilitating medical conditions that were listed are chronic pain, severe and chronic pain, arthritis, muscle spasms, and severe nausea. And really, there's, I'd say probably there's quite a few diseases or symptoms of diseases or in treatments that qualify, but really most of them have a very low participation. They're not usually the main condition that's causing it. These 5 here are by far the most that are cited. And then in July, so this is just 1 month out of the year, just 1 month's data, 416 physicians provided written certifications. And I think when I looked at that data, there were around 12 or 13,000 maybe new certifications issued in July. And then there were several thousand renewals that were issued in July as well. Next, please. Okay, so kind of what's next on the horizon. So we kind of understand federal law and enforcement. We look at really the direction in the Michigan law is really centered around the use of certifying, evaluating a patient, seeing if they have a debilitating condition, one of the qualifying debilitating conditions, and then determining whether or not the use of marijuana could be potentially beneficial for them, for their condition or for symptoms of the condition or treatment. And that's kind of what it says. That's kind of our law. So next we have to kind of take a look at what's happening with the licensing boards. So the Federation of State Medical Boards does have some criteria out, some guidelines they adopted a couple years ago. And part of that was in response to what they were hearing from their member boards, so all the state medical licensing boards providing input. And what the states were saying to the Federation was, we need to know what happens if we have physicians who are using recreationally, or whether they're using it for medical purposes. And then what do we do if they're recommending it to their patients to use as well? So kind of those three things were kind of the high on the state boards lists of we need some guidance here from you at the kind of the national levels. Next, please. So the Federation passed a resolution in 2016 that really says, because we don't really know, have all the evidence there regarding the clinical efficacy and the impact that might have on someone's impairment and for how long, and what amounts and really kind of the quality and the number of cannabinoids and all this type of thing that can be different from product, from, you know, kind of product to product to seller, from seller to seller, that we just really think that physicians should not use it for medical or recreational purposes while they're practicing medicine. So that's kind of the resolution that they passed at that level. And then they also updated their policy, which indicated that marijuana, they consider marijuana a substance that does impair ability at this time. Next. And then for the guidelines, there's some good guidelines if anybody's interested in looking at them. I think that these are things that probably individuals would do really if you're treating other conditions as well, and other substance use issues as well, that you would take these steps. So I think they're kind of common sense, but they're good to see and to know that they're out there so that you can be compliant with them. First of all, again, kind of that physician-patient relationship. There needs to be that evaluation of the patient. There needs to be kind of an expectation that this is going to be longer term than just I'm here to get my card and then I never see you again type of thing. That there really is that expectation of interaction moving forward between them and a relationship developing. And then the proper evaluation of the patient. So doing that full medical history, finding out what other medications are they on, you know, what are they, you know, checking the maps to see if they're on any other, you know, are they on any opioids, you know, are they on other controlled substances? Really doing that thorough evaluation of the patient's condition. What, you know, what other diseases might they have? What comorbidities might they have? All that type of thing, doing that. And then talking to the patient, you know, having that kind of shared decision making. You know, here's the, you know, here are the risks of it. Here's the potential benefits. You know, maybe even saying, you know, the evidence isn't out there to fully support this, but here's some studies have said this, some studies have said that. You know, kind of talking through, making sure they understand if they choose to use it, especially for medical purposes, what you know, what they should expect from that. And then there's a recommendation that a treatment agreement be put in writing. Some of that would be, for example, maybe, you know, again, going through the risks, maybe putting in for how long. So let's try it for, you know, 30 days and reevaluate after 30 days and see how things are working for you. So really kind of spelling that out so everybody understands what the expectations are, what the limitations are, what the possibilities are. Next, please. And then again, kind of determining, does somebody have a qualifying condition? And some of that too will take, you need to think about whether or not there is evidence that even if they have a qualifying condition, whether or not it might or might not be helpful for them. And unfortunately, this is, I think, where some of the issues currently are with the lack of research, is that for many of the qualifying conditions, there just really isn't good evidence out there either way as to whether or not it's beneficial or not. And then kind of ongoing monitoring of the plan, updating it, modifying it as necessary. And then if for some reason you are have a patient who maybe has past addiction issues or mental health issues, and it's not your area of specialty to treat those conditions, then that's the time where you should consider referring that person to somebody with a little bit more expertise that can help them navigate this decision in light of their other health conditions. Then also to document in the medical records, which again, I think, you know, under Michigan law, the definition of bona fide patient physician relationship includes that in there already. So keeping good medical records, documenting what you've done, documenting that you're talking to patients about risk benefit, putting that all in there. And then finally, and where it says physician conflicts of interest, the Federation of State Medical Boards is advising that if you are going to be talking to patients about using marijuana for medical purposes or certifying that they have a qualifying condition, you should not have any interest, financial or otherwise, in, let's say a provisioning center or in the industry, or, setting yourself up to be right next door to a provisioning center. So that you need to be very careful that your decision-making isn't seen to be influenced by some type of financial or other interest in that. Next, please. I also put on here too, even though in Michigan, nurse practitioners and physician assistants can't do the certification right now. I just put this in there though, because I think it's important with more patients using recreationally, and we'll start talking about this a little bit and kind of some best practices moving forward. But as patients are sharing that, to understand what the national boards or associations might be saying as far as what qualifications, skill sets, protocols, best practices individuals should have if you're working with patients who might be using marijuana. And so there's a link to those guidelines there as well. Next, please. And I also included the American Academy of Physician Assistants, kind of their position statement and where they come, kind of where they view the use of marijuana and the skill sets that their physician assistants should have. Next. So when you're thinking about, in a day-to-day, how do we now deliver care? And we have a little bit of conflicting laws and regulations. I think kind of going back to all the advice says, follow your professional procedures. Again, how would you evaluate any patient coming into you, for care? So things like asking about whether marijuana use is something that they engage in, just as you would asking them whether they use tobacco, or how often might they have a drink. Is it occasional, social, once a week, twice a week, every day, multiple every day, kind of asking that as part of the medical history, so that what patient is taking before you might need to be prescribing or recommending any other medications, and even as we'll look in here in a couple slides down the road, how it might be affecting them in the presentation of other symptoms that they might be having. So you might need to ask yourself whether or not the marijuana use or working in the marijuana field is maybe contributing to some of the symptoms that they're showing. And again, I think, some of this tracks conducting an adequate examination. We talked about that under the Federation of State Medical Boards, but again, for whether the patient's using for medical purposes or recreationally, really do a thorough examination. Talk to them about that, the use and risk. Maybe somebody is using, and so it's opportunity to remind them that it slows down their reflexes, and driving while you're under the influence is not a good idea. So it gives you that opportunity to engage in conversations with them about potential risks, making sure, excuse me one moment, making sure that they know that they need to store it. So for maybe you're talking to a patient who has small children at home or teens, or making sure that they understand that they should be locking that up and it should not be in sight, someplace where somebody can easily get to it. Edibles is kind of an interesting issue here too, that because of the way it processes more slowly, you don't feel the effects right away, but then it can be more potent. So sometimes people will think, oh, hey, I had one cookie and I still feel fine, so let's have another one. Well, then all of a sudden you've really taken too much. And it was had a presentation I thought was very interesting. It was an attendee, and they showed a slide of, you know, what is a serving. It was really not even a whole cookie. It was about 1/6 of a cookie. So I think a lot of people would have a hard time eating 1/6 of a cookie. So, you know, just those types of things that people might not be aware of, that it gives you opportunity to have those discussions. Also important to try to keep out personal opinions and really try to stick to where you may have had some evidence or seen some studies. You know, kind of keep it to the facts, keep it to what you know, what you've read versus how you feel about it. And then again, you know, kind of inform yourselves as to the benefit and risks associated with that. So for example, there's been some information out there from the Heart Association regarding some studies, some recent studies that have showed some issues with heart. They've seen maybe some benefit with inflammation, but they're seeing more heart abnormalities for folks and people who are using longer term. So increased risk of AFib, that type of thing. So, you know, being aware of that. In the ER, they're starting to see more individuals showing up with overdose symptoms and a condition that causes frequent vomiting by long-term users. So some of those things, you know, again, some of the anecdotal stories are starting to come out in some of the research that's, you know, again, maybe not as comprehensive as we'd like, but some of that information is starting to come out. So just kind of being aware of what's happening in your specialty and for the patients that you see and the types of, you know, patients you see, you know, what is out there, what literature is out there, what's kind of happening in the last couple of years. As more and more people are using it, we're starting to see in some of the states like Colorado and California who've had it much longer than Michigan, they're starting to see, you know, kind of more of what's happening and kind of some of the usage and some of the negative and positive impacts of it. Next, please. You know, I think that it's important to kind of let folks understand that there are some harmful effects with this. There are some known harmful effects with that. So again, we know that there is increased impairment of memory, coordination. There's increased risk of being in a motor vehicle accident. That evidence is being borne out, again, in those states where they've had this legalized much longer than Michigan has. You're seeing those increases. Even just from if you're smoking it, kind of from a status of, you know, smoking tobacco, smoking marijuana, that smoke can be bad for you. The impact if you're pregnant or wanting to be pregnant. So some of those things, it's important to kind of let patients know, kind of be aware of yourself, what is out there, and then seeing if there are, you know, is there a legal alternative that might have the same known benefit or even more of a known benefit than the marijuana. Next. I think this is kind of similar to, you know, kind of, you know, what we just talked about too, kind of keeping yourself informed, knowing what's out there. What is the patient's condition? What other medications are they in? Again, one of the problems is that we don't have good data yet on really how medications interact with each other, but just being mindful of other ones and being careful as you talk to that and making sure patients are aware so they're making informed decisions, that they truly are having informed consent when you're talking with them about that. So one of the things I thought was interesting when we talk about, you know, what do you need to think about if patients are coming into you and sharing with you that they are using, another interesting thing is to think about is what if they're working in the industry. This is a booming industry. It's growing. It's an industry that takes a lot of water, takes a lot of heat, a lot of hydration. So there are things in the growing environment that can be problematic to individuals. And MIOSHA has a fact sheet actually out for the industry of things to look for from health consideration and protecting workers' health and safety while they're working in the industry. So things like, you know, kind of looking at molds, allergens, you know, could that be affecting a patient with asthma? You know, is that something that needs to be thought of? If someone's having something that doesn't make sense, you know, where do they work? Do they work in this environment? Kind of thinking through those types of things. You know, maybe you're going to be seeing more accidents if something goes wrong with the machinery. Again, we have the lighting eye hazards with the grow lights. You know, so is that something that, again, you might see patients with kind of unexplained condition, but when you dig deeper into it, maybe it's kind of a workplace hazard that they've encountered. Next, please. The other thing I wanted individuals to know is from the employment side of things, as employers, the Act does not require you to allow an employee to use marijuana at work or on your property. So you have the right to prohibit that. It does not prohibit you from disciplining someone if they violate a workplace drug policy or if they come to work under the influence or they're impaired. And it doesn't prevent you from saying, you know, I'm not going to hire somebody who has done this. So there are some protections there. But there was a court case where someone was fired that and challenged it. They said that the employer was within their right to do that, but the employee could potentially also file for unemployment benefits. So that's just an FYI for you. Next, please. So I think going forward, one of the things that we'll need to see, obviously, from the medical community is, you know, looking for patient safety. So, for example, the legislation that passed in Michigan with the safety labels on there for pregnancy or breastfeeding or intent to become pregnant. Obviously, something that MSMS supported. But we also feel that there are other types of labels that could be on there as well that might be helpful to patients. So that's something, you know, the medical community can come together to see, you know, what types of information should be on products. What should people be aware of before they choose to buy or use something. Rules, as the rules continue to be developed, we have the opportunity to be at the table to provide public comment on those where appropriate, as far as when it comes to how a rule might impact someone's health or the ability to deliver healthcare to them. Programming, you know, what type of information and programming do you need? Do other healthcare team members need, you know, public facing materials? How can we come together to put together materials that are helpful to all? Also, I think advocating for clinical trials, certainly this is an area I think that there's overwhelming support from all sides. Is the need for better and more trials, more research, more funding for research, product that can be product that can be used that you know what's in it, so that it can be replicated, that can be consistency in that. And again, kind of public health surveillance efforts. What is the impact? How are we tracking what's happening as more people use? And this becomes a more normal use in Michigan. How is that impacting health, traffic accidents, increase in other disease states, et cetera. So those are all things where the medical community can take a leadership role in those. Next, please. This just I was sharing kind of MSMS'S advocacy agenda around marijuana. And again, the need for clear labeling, make sure that the potency is known. So one of the issues I think many folks might have heard is that, it's more potent now than it ever has been. And actually, I was just reading an article where they think that there's THCP, which is 30 times more potent than THC, is a new cannabinoid that they found. So again, like, people understand how much they are actually taking when they either are smoking it, ingesting it, vaping it, whatever, however their mode of transmission is. So people need to know about those types of things. And again, not having it be out in public places, not misrepresenting the health benefits of it. So that's a huge concern, is people saying, oh yeah, this will, settle your morning sickness. So it won't harm the fetus at all. So those types of things are troublesome. Or in Michigan, we are lucky that there are restrictions on how something can be packaged, so it can't be made to look like a candy, for example, to really to try to get at younger people using it. Excuse me. And then again, kind of looking at illegal activity and making sure that we aren't seeing, it being sent to other states inappropriately and that type of thing. Next, please. And then this is just, you can see on the slide, as far as really doing more funding for research, for legitimate research to look at long-term consequences. Next, please. And then, excuse me, supporting a substantial portion of tax revenue towards public health purposes, so that we can look at really education, looking at substance use prevention and treatment, and then again, looking at increasing surveillance efforts. Next, please. This slide is just a list of resources. It has the MDHHS's information, some other good tools. So if you're wanting to look up information on, what can I give a patient who's pregnant, or maybe you yourself are pregnant and wanting to know more information about its use, here's some good facts as well. And I did include Colorado's. I thought Colorado has a website that they have some very nice, nicely done resources. So I included those because I thought they were very well done. Next, please. That is it. So I appreciate being here today. Hopefully you have a little better understanding of what Michigan's laws provide as far as responsibilities, as far as medical use of marijuana, and how the federal law intersects with that as well. I'm happy to try to answer any questions you might have.
Thank you for that. That was great. We can take any questions either if people want to ask them or in the chat box. And I think as somebody asked about the slides or the presentation, that will Facebook Live, so it is available there, and we can also have follow-up information on the website.
And my phone number and email are on there as well too, so feel free to reach out if you think of something afterwards.
Absolutely, and I believe we'll also be sending out a evaluation to registered participants too. So you'll have the opportunity to provide some comments and ask some questions perhaps for other presenters or for us to follow up on later. Okay, well, if there are no other questions, we appreciate folks joining us, and we look forward to additional series as well and hope you will join us. And did you have anything else to add, Gabrielle? Oh, you're muted. Got to happen at least once during a Zoom.
Thank you. Our next series event will be next Thursday, August 27th, same time, same place, but you will need to register via the Zoom link at the washtenaw.org Cannabis in Practice webinar series. Our speaker next week will be Dr. John Hopper. He's an internal medicine and pediatric specialist at St. Joseph Mercy in Ann Arbor, and he'll be targeting addressing adolescent use of cannabis.
Oh, it looks like we just had a couple of questions pop up. So let's go ahead and see if we can get those answered. The first one, medication can be prescribed by doctors that is similar to the use of cannabis, like Marigold.
And I'm sorry,
that-
I'm not a clinician, so
Yeah.
it might be a good question for next week. On
For
that
next
one,
week,
so,
yes.
Yeah. So I apologize.
There is another one in the chat box that asks, is there a measurable toxicity for marijuana that can be used by police?
Well, that is a problem right now as well too. So unlike being able to do a breathalyzer, they're not there yet. My understanding is that they are testing some different machines or processes to get a better read on that. But right now, really, the best way when I've gone to some of the presentations to some of the courts is to look at, again, kind of the signs and symptoms of whether someone might be under the influence or impaired. So at this time, there's not a good way to measure that.
Okay, thank you. Okay, any last minute questions?
It seems that we do have one by Alec. What are the current precautions recommended for pregnant patients?
Oh, thank you.
Sure, that they not use. That they be aware that if they use, that there could be risks to the fetus, lower birth weight, that type of thing. So yeah, and I did put on, if you went to, on some of the resources, there are some more links to that pregnancy specific as well too.
Thank you. Did we miss any other ones? Okay.
I'm not seeing any other ones.
Great. Well, I hope
We've been-
everyone enjoys the rest of their day. Thanks for having me
Yes.
today.
Thank you,
Thanks all
everyone,
for
for joining
joining.
us.
Right, we'll see you next week. Please consider signing up for our next series next Thursday at the web link in the chat box. Thank you, Stacey, so much, and have a great rest of your week, all.
Thank you. Bye-bye.